Oturumun 3. konuşmacısını davet edeceğiz şimdi. Buyurun.
Another major player in the area of alcohol policy is the European Commission. Our next speaker is representing the European Commission, Michael Hübel. He has been working there since 1995, and he has been responsible for the implementation of the EU strategy on alcohol. Please, Michael.
Well, thank you very much, Chairman, Ministers, Excellencies, ladies and gentlemen, colleagues. It's a great honor and privilege to be invited to take part in this important symposium on the global work on alcohol-related harm and to present the European Union's approach in terms of both the alcohol strategy and the link to the agenda on non-communicable diseases. And already from the title you see how well, I think, the agendas and the approaches match between the approach of WHO, both at global and regional level, as the two previous speakers have been indicating, and the work we are taking forward in the European Union. And it's important, I think, that we have and we develop these synergies between the instruments of the European Union and the global health leadership which WHO is providing. It is obvious, and we've seen many figures, I will not go through any slides on figures, that alcohol-related harm poses important health and social challenges in the member states of the European Union, and it poses them really across member states. And that's an important statement, of course, given the kind of variation you also saw in Jürgen Rehm's slide around some of the developments in different member states. Clearly, the problems and the issues are very similar around health and social harm, issues around underage drinking, binge drinking, drink driving, and others, which really drove member states of the European Union to very strongly, in addition to the work which is being done within the World Health Organization, to ask also the European Union to start an approach and a strategy on addressing alcohol-related harm. We adopted the strategy in 2006 as an approach where we would support member states, because like WHO, we don't run health policies. Thank God, perhaps. We give support to member states, and we work in those areas where there is competence of the European Union which is relevant to the agenda. And you see important timelines. We produced the first progress report in 2009. We're encouraged by the Council to continue and have just gone through the independent evaluation of the strategy. We would like to address alcohol-related harm in terms of 5 key objectives: protecting young people and children, working on road traffic and accidents and injuries, working around alcohol-related harm among adults and the workplace, information, education, awareness raising, consumer information is part of that agenda, and developing a common evidence base. And I should say that particularly on the common evidence base, we were privileged to work very closely with WHO, so that we are now in a situation that on alcohol policy we have a common evidence base for the WHO European region and for the European Union. With those 2 links Gauden showed, we now have a situation where we have common criteria and a common reporting on alcohol-related harm, both into the EU alcohol strategy and into the strategy at WHO level. We work with member states, obviously, and we have created a committee to coordinate work around that. We also work with broad stakeholders on alcohol and health, because we do feel that the European Union also has a convening power to bring different groups and forces across society who have a role to play in addressing alcohol-related harm together. And we do this through the European Alcohol and Health Forum, which has been in operation since the beginning of the strategy in 2007. And of course, thirdly, we work in those areas where we have generic EU responsibilities in areas such as transport policy, research policy, employment, I mentioned the workplace, taxation, youth policy, and so on. In terms of the broader stakeholder engagement, we have started in 2007 with the Alcohol and Health Forum with 56 members. We're now at 71 members across the spectrum, from public health and consumer organizations, health professionals, self-help groups, to media and advertisers, to the alcohol industry, to everyone who has a role to play. And the forum works on the basis of specific commitments. It's not a free-for-all business. Stakeholders have to engage. They have to engage in concrete pledges for actions and work. They have to engage in terms of those pledges, in terms of transparency, of reporting, of indicator developing. So everything is transparent about this kind of work. And I have no time to go into any detail of these commitments. But some of the work Marianne Ska mentioned, for example, on voluntary activities to put warning labels on alcoholic drinks are commitments under the forum. There are voluntary engagements around marketing and advertising, particularly in the digital world, which we can discuss. And there are a host of other commitments which play a role. We've been quite encouraged, and we feel that we have been able to play a supporting role in that in terms of helping member states along. And if you look at the reports we collected as part of the evaluation, we see developments in terms of the national strategies, largely due, of course, to the global strategy, but also a little bit, I think, due to the closer cooperation at the European Union agenda. We see convergence in terms of drink driving. We see convergence in terms of rules regarding protecting children and young people. We see less convergence and less progress clearly in the agenda in terms of adult drinkers and the agenda of alcohol at the workplace. So we evaluated the impact of the alcohol strategy, and the evaluation, in a very encouraging way, has told us that the strategy has provided this common evidence base, this common EU-wide approach to address the alcohol-related harm issues. It has given support to the member states, and clearly we have seen a lot of progress along those lines. Let me just rush through this a little bit. The evaluation is not the end. The strategy stands, and the strategy obviously will be a guiding principle in terms of continued work on alcohol and health in the European Union in the future. Harmful alcohol consumption remains a major risk factor, and of course is a major risk factor for chronic diseases. And that brings me to that second part of the presentation, to just say very, very briefly that, again, following the example of the international discussion triggered by the UN high-level meeting, and clearly, again, the way discussions have been going also in WHO, we are also more and more seeing the risk factor of alcohol in the general context of chronic diseases prevention and management, and see this as a way of bringing together different risk factors, different disease endpoints, because of course things interlink and overlap, certainly in certain risk populations. So we work on all these risk factors in different strategies where I have not much time to go into on disease prevention. And we're particularly concerned about the chronic disease and also the alcohol agenda in terms of aging. We're putting a lot of emphasis on young people, and rightly so. But I think it's quite important that we also put emphasis on aging, on older populations, changing drinking patterns when people go into retirement, when they go through traumatic experiences in their families, and the kind of conditions society places and gives around that. I think it's a very, very important topic, which again, I think it was the Swedish presidency in the European Union which really started this off. And this partnership on active and healthy aging is an important instrument we have developed in that. The Council of the European Union, the Ministers of Health, have asked us in December 2010 to develop options on taking forward work on chronic diseases around 4 key topics: prevention and promotion, healthcare, research, and information. And we're in the process with member states. This will go back to the Council under the Lithuanian presidency at the end of the year. We're in the process with member states to develop that agenda of working together on chronic diseases, which will really tie the work on risk factors such as alcohol together with the specific work we do on the chronic disease agenda and with the kind of added value which hopefully we can be providing at EU level. So the slides will be available, but just to say that both on alcohol prevention specifically and in a broader way on chronic diseases, we have launched together with member states what we call joint actions. We're putting money on the table, member states are putting money on the table to work together in a sustained way around these important policy priorities. And again, I'm happy to report that WHO is part of both of these joint actions, and this is a kind of work we're taking forward together, probably, hopefully, in terms of adding value to member states and helping to address the problem of alcohol-related harm at EU level. So, chairpersons, that was rushing through a presentation which was intended to be slightly longer than you gave us, but I hope it was still useful to show how EU work ties into the important work which is being discussed in this important symposium. Thank you very much.